We know that we're in the second wave, and we know that it will be worse than the first wave. But what we don't know yet is how bad the second wave will be.
Ontario Premier Doug Ford there confirming his province is in its second wave of the COVID-19 pandemic. Ontario hit its highest number of new daily cases ever, 700 in the last 24 hours. The Premier says he's not ruling anything out, but didn't today add any additional restrictions. So why might he be hesitating on restrictions as he spends $52 million to recruit and train 3,700 frontline healthcare workers? We want to bring in the power panel a bit earlier than usual because, as you can see on the corner of your screen there, we are awaiting a press conference from the Premier of Quebec, which we'll bring you to live. Joining us today for the power panel, Brad Levine of Council of Public Affairs. He's in Langley, British Columbia. Over in Toronto, Jenny Byrne, former top staffer to Prime Minister Stephen Harper, and Ontario Premier Doug Ford, now a principal at Jenny Byrne and Associates, and Yolande James, former Quebec Liberal Cabinet Minister, joins us from Montreal. Hi, everybody. Good to see you. It's a stressful time for a lot of people watching these numbers creep up. Jenny, why don't I start with you? From the perspective, sort of a political perspective, the implications for government. We certainly see, I think it's fair to say, a hesitancy to revert completely back to the way things were in March, but they're trying to navigate a different road if they can, but it's getting to the point where you can see the pressure is on to a certain degree.
Yeah, obviously the pressure's on from some people in terms of going back to the so-called lockdown that we had in March, April, and May when we first when COVID first hit us, I guess, so to speak. I think, though, that where governments have to tread is that there is not a consensus, a public consensus, as to going into lockdown. I think what a lot of Canadians were expecting over the last 6.5, 7 months is that governments would work with public health officials to ensure that we were prepared for if there was going to be the so-called second wave when it hit in the fall, because politicians and health officials have been talking about it. So I think what Canadians were expecting is that governments were using this time to ensure that we were prepared and we had come up with tactics in terms of to live with if there was a second wave. And I think what Canadians are getting concerned about is that governments did not spend the last 6.5 months doing that.
I think that's a really interesting point. And Brad, I wonder what you think about this as well, because I do feel there's a sense of frustration among people who, and this isn't directed at one certain political party, but kind of many levels of government. Like, we were all told the second wave was coming. Why does it feel like it's a bit of a surprise, and that we're that the reaction is almost not necessarily surprise from the governments, but like scrambling to try and address what's at the heart of the issue? What do you think?
Yeah, absolutely right. Public health officials did warn us that the second wave is coming. Dr. Bonnie Henry here in British Columbia was saying many months ago that we are going to have a second wave. It's just a matter of when it comes. That's the only thing that's we really got to keep our eyes on. The initial moves by government for lockdown, first and foremost, was to ensure that our acute care system would be able to absorb many Canadians who were going to be potentially in need of that. Now, acute care needs never did come. And I think perhaps one of the reasons why we see some politicians scrambling at this stage is because they thought that maybe we were out of the woods and that we could avoid a second wave. That clearly is not happening in large parts of this country. That which we were doing was not working. And obviously now we have a situation, your stats at the top there are showing that this is affecting young people. We know we've seen incidences around the country where people in many areas of the country are ignoring these physical distancing measures. They're not wearing masks. We've learned a lot over the last 6 months. But those politicians who thought perhaps that we could ride this out in one wave I think are waking up these days, seeing that was not going to be the case.
In about 10 minutes' time, Yolande, we're expecting to hear the premier of the province you're in right now in Quebec address that very sentiment. Basically, 750 additional cases there. It looks like Montreal and Quebec City are going to go into sort of like a different level. I think it's called the red zone, right? So highest.
I'm in the red zone.
Okay, so you're in the red zone. So give us a sense of the sentiment there and what you think the implications for the government are.
Well, for first on the sense, part of the problem is, and I think honestly, they were well intentioned in announcing this color-coded system a few weeks ago in preparation for the second wave, saying green, orange, red being bad, which is where we are, and kind of giving us the hope that they would be able to, if there were going to be restrictions, kind of put them in different compartments. That hasn't worked out because essentially we're all red and people are kind of just wanting to know what exactly does that mean? Because honestly, from green to yellow, from yellow to now, we haven't seen much change in people's attitudes. Therefore, we see the numbers continue to increase. That being said, by no means am I trying to make this sound easy, because in my read politically, this is a no-win. A no-win in that if you, and now you have to address the fact that our public health network right now is really stressed out, burnt out. Nurses from the first wave have not recovered already. An intensive care unit in Gatineau had to be closed temporarily. So there's that stress there, and you have to be able to address that. On the other hand, as we're hearing, the premier is about to announce in a few minutes that he's going to be closing restaurants and bars. I just think of those restaurants, people that we all know that managed to survive the first wave, and you're essentially letting them know that this is it, not to mention the anxiety that it could cause for parents, public and mental health and so forth. So really, this is a really no-win situation. I would imagine in Premier Legault's situation anyway, you have to be thinking of, I've got to be able to minimally keep schools open, and that is whatever restrictions that he's announcing today are going to hopefully favor that.
And I think, if that's significant news, if they are closing bars and restaurants, because we haven't seen that step taken completely, like the full closure of those anywhere else. We've seen obviously occupancy reduced, the hours reduced, but nothing to that degree. I think that's where sort of government becomes even more significant, Jenny, because having interviewed people who run those businesses frequently on this show, they barely have survived the first round of this. And I think, if a government of any level is going to announce that this is necessary, which is totally understandable from a public health perspective, they have to be ready at the same time to say, here's what we're going to do to get you through it. Because if they don't have a plan in place, I just can't see people who run their own businesses in that capacity being able to survive.
Agreed. It's been very trying on small businesses, especially restaurants. The Canadian Restaurant Association a month ago came out with a report that at least as of a month ago, 60% of restaurants probably wouldn't survive if these measures continued over the course of the next year. And I think if restaurants start to close, I'm sure Quebec is just the first province that's looking at this. That it's going to be devastating for that sector and the spin-off effects for it. But again, I'd like to say that not to repeat myself, but governments should have been prepared for this in terms of not just communications, but also a plan. It's kind of like Yogi Berra. It feels like deja vu all over again, because if you look in Ontario and Quebec, the cases of COVID in long-term care facilities are on the rise as well in both of those provinces, where it was a huge problem at the start, on the onset. And Vashi, we talked about this on Thursday. If I was Premiers Legault and Ford, I would have been paying a lot of attention to the speech from the throne on Wednesday that said that the government is going to be bringing in national standards for long-term care facilities.
Yeah, I mean, just to close the loop on that aspect of things, Brad, I mean, this ends up likely changing the dynamic or the conversation even taking place here in Ottawa. A few weeks ago, we thought we were going to be talking about and parties would be negotiating what a long-term recovery looks like. But now it's almost as though, like a little bit of deja vu, we're going back to that period where there were these big shutdowns, and not to say they're going to be as extensive, but where the government's response becomes very much a focus point for all sorts of discussion and debate between the various parties. Like if businesses are going to be closed down, they're going to be looking to the province and the feds for some help in trying to get through it. And they've already done that once. So I think it's going to be, kind of change the conversation.
Yeah, no, the conversation will move away from, as you say, the economic recovery. We have to go back to the conversation about how we begin to contain the spread, because the system is not going to be able, if we do what they did in Florida, where they just threw up their hands and said everyone for themselves. Our system will collapse, both economically as well as our healthcare system. So, we're going to have to go away from recovery and talk about containment. That is going to be a conversation between all three levels of government. It is going to, we're going to have to revise the expenditure gap again. That what we saw over the last couple of weeks. And what we saw in the throne speech is going to have to perhaps they're going to have to go back to the drawing board again. Not saying prorogue again, but certainly they're going to have to look at what is needed, but was not contained in that throne speech again. And I think it's going to feel a lot like May again, with daily updates from all of the political leaders as we had for many of those weeks, where we had daily announcements. For what the government was going to be doing and for what sector. Because as Jenny rightfully points out, the hospitality sector, if large components of the hospitality sector are going to be shut down, we're going to need to revisit, do we have the supports in place to keep people, hand to mouth? Do we have enough supports in place to keep these businesses alive?
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.